Okay, well, thank you for inviting me to talk about just one of my favorite topics. Medical history has been a hobby of mine for ages, and I have a collection of antique medical instruments, medical books. I've studied medical history and really enjoy looking at it. And I thought it would be good to talk to you today about medicine in Northborough, medicine in general, in the 19th century. That was a period of time in which there were major changes in the way medicine was practiced and who was practicing medicine. And so I thought you might find it as interesting as I do. So when we look at Northborough, and it looks like now I've got a remote that isn't working. Let me just do this. There. When we look at Northborough, it's gone under a transition during that time as well. You had about 700 people living here at the beginning of the 19th century, about 2,200 at the end of the 19th century. You went from predominantly just rural, agrarian kind of economy to having some mills, having a train come through and the like. You were served during most of the 1700s and early 1800s just by one doctor. And then, we can sort of look at this first era of medicine that occurred. I like to divide the 19th century into two different areas. One is the up till 1840 and then after 1840. So big changes occurred in 1840. Prior to 1840, there weren't many changes for 1,500 years. Obstetric forceps were invented in the 1500s. The smallpox vaccination was developed in the late 1700s. Not so much other than that. And medicine really wasn't a field that was connected to science. It wasn't really thought of as being a science, closer to the ministry than to a science. And the big idea was to restore balance, to restore people to good health by restoring their humors to balance. And the humors that were in the body were blood, phlegm, black and yellow bile. Depending on what your complaint was, they would relate it to more of one thing than another. And then the way they went about restoring balance was to bleed you, to get excess blood out if you looked ruddy or if you felt warm, to give you things that caused you to throw up or laxatives. So they were restoring balance in a way that wasn't terribly pleasant. And some of the medications, we now know mercury, arsenic, not too healthy, but they were the kinds of things that were used. In addition, doctors were basically preparing their own medications. And so one doctor's medication may be different than another's. One doctor's red pill may be different than another's. And the pill that one doctor makes one day may not be exactly the same as the one he makes a year later. So in 1808, the Massachusetts Medical Society developed the Pharmacopoeia, which is basically a recipe book, and hoped that they could begin to standardize things that way. Very few tools at that time, dental extractors, which were really frightening looking things, amputation instruments, and I brought a set of amputation instruments here from the Medical Society from that period of time. I brought some obstetric forceps as well, so later on you can look at that. And bleeding instruments, which were used, and I brought some of those too, although don't play with them. So those were the tools that were available. That's what was done. And education, how you became a doctor, very few medical schools. Most doctors were trained as apprentices. They would spend 2 or 3 years. There was no standardization of the curriculum at all. And then they would be certified essentially by the person who they apprenticed to. So that is kind of the picture up to 1840. And, and in that period of time, you can imagine that there was an appetite if what was on the menu was being bled, getting something that would cause you to vomit or have diarrhea. People might be shopping for other things. And so there was quite a choice that people had available to them. Homeopathy, which found its way here from Germany, Dr. Hahnemann, was built on the theory that like cures like, and minuscule tiny particles thought to relate to a disease when given to a person would build within them the resistance to cure themselves. Water cures, where you were soaked in water or was run in one side or the other to purge you, to cleanse you, mesmerism, animal magnetism, the power of the mind to heal. Thomsonianism, Dr. Thompson was in New Hampshire and was promoting the use of botanicals, mostly a gastrointestinal-oriented therapy regimen to clear you out, and electric treatments, which were very popular at that time as well. So that was what was on the menu as an alternative to the regular medicine that was occurring. And sickness and death in that era, the average lifespan was in the 40s. 1 in 7 babies died before their first birthday. About 1 in 100 women died as a result of childbirth. And to give you a comparison, the number for women dying in childbirth now is between 1 in 5 and 10,000. So 1 in 100 is really a big number, particularly if women were getting pregnant 6 or 7 or 8 times. The only vaccine was for smallpox. There was no knowledge of infections or the benefits of hygiene, even though if we look at the diseases that were prevalent then, they were mostly what we now know to be infections, but they were thought then to be due to these miasmas that were rising from the gas in the earth. Chronic illnesses such as diabetes or hypertension weren't known. Nobody was checking sugar. Nobody was checking blood pressure. So really, they didn't know that. And cancer really wasn't much of an issue. It was recognized when it became advanced. But people weren't living that long, and so it was less of an issue. In Northborough here, there were roughly 50 births a year, all at home, and 35 deaths a year. And if we look at what people were dying of, the number one by far was what was referred to as consumption, which is tuberculosis, and scarlet fever, an infection, due to strep, pneumonia, usually due to strep, whooping cough, another infection. So you can see that the deaths in this community and in all communities at that time were dominated by infection. Now, if we look at the history of medicine in the 19th century in Northborough, you just have to really remember one name, Stephen Ball. Stephen Ball the first practiced was our first doctor. He practiced during the 1700s. Stephen Ball the second was the one who practiced during this span of time up until the 1840s or so. He was very industrious. He was very busy and popular. He trained other doctors, so he had people who were apprenticing to him. He made his own medications. He was known as a bit of a character. He would, in the winter, he's described as wearing this large fur hat that was bigger at the top, and he would waddle in to treat someone in their home. And it says invariably he would be bleeding them, and then he would kind of just sit down at the kitchen table, take out his saddlebags, and get out all these tins of various powders and salves and begin to mix something up for them. So that's the kind of picture that we had. And just to give you a little bit of a drive-by, he was at 38 Main Street, which is practically within sight of this building, and that's what the house looks like today. The house is still there, and that is where Stephen Ball I and Stephen Ball II lived with their 9 or 13 children. And if we look at the kinds of things, Ellen talked to you about the recipe book and everything. This is a distillation of one of his recipes. So he would sit there and he'd make this up for somebody. You don't need to look at everything here. What I want you to get is that there were over 30 things in it. And so you weren't likely to try this at home. You weren't going to be copying his recipe. You weren't going to be looking to someone else to give you the same thing. This was really complicated. It took advantage of a lot of things. So he had items in here that were from Indian medicine and the like. So he was appealing to people who had a lot of interest in how they were treated. Some of these items we know were toxic. But odds are he avoided them poisoning his patients by virtue of the fact that they were diluted down so much with what he was putting in his unguum polycrest, which is Latin for multi-purpose salve. So this is a picture of medicine in the first portion of the 19th century here in Northborough. And in addition to that, next to his house, he had another store right where the library is today. And he had some preparations that he sold directly to patients that way, to the public. He also commercially advertised Ball's bitters, and as you can see, it cured nearly everything. And basically, he was taking care of those who didn't want to go to the doctor. So if you don't want to go to the doctor, I got something for you too. And he was doing this as well. He was a member of the Worcester District Medical Society, so that meant to get in those days, you needed to appear before the censors. They would question you regarding your management of cases and your knowledge of traditional medicine and approve you, and then you would sign their bylaws attesting to follow the bylaws, which I thought was kind of interesting. I don't think the officials from Worcester got out here very often, because bylaw number 14 at that time was if you sell any kind of secret preparation or anything like that, you'd be thrown out. And they were throwing people out. So he managed to get to slip under their radar regarding that. Now, if we look into the second era, after 1840, a lot of things start to happen. So one thing that I've noticed in looking at history is that ideas have their time. And so it's not unusual to see an idea pop up in a couple of places at about the same time. Its moment was there. And so at about the same time, Dr. Semmelweis in Vienna, Oliver Wendell Holmes in Boston, through different approaches to the problem, came to the conclusion that something doctors were carrying with them when they took care of women in labor could cause childbed fever. Childbed fever is an infection in the uterus. And they didn't know what an infection was. They didn't know what bacteria was. They knew something was going with those doctors. And if the doctors were to wash their hands, they recommended they use carbolic acid to wash their hands, that they would lower the risk of that happening. And Dr. Semmelweis did the experiment in Vienna and cut the infection rate by about 90%. So it was effective. Despite that, both Holmes and Semmelweis had decades of frustration as doctors rejected their theory and said, no, that is not the case. They could not deal with the idea that something they were doing was actually harming patients. In the 1840s also, Morton in Boston with ether, Wells in Hartford with nitrous oxide, Long in Georgia with ether, and Simpson in Edinburgh with chloroform. All of them, within a couple of years of each other, came to the conclusion that inhaled chemicals could render someone senseless, and therefore they would not be feeling pain, and this could be used to advance surgery. So it's really remarkable how these popped up about the same time in all these different areas, but that revolutionized medicine. And again, Florence Nightingale in England and John Snow in England, different techniques, roughly the same time, basically came to the conclusion that hygiene could contribute to health, that clean air, clean water would make a big difference, and showed remarkable results in promoting that. And over the next 20 years or so, from the 50s to the 70s, Pasteur with the discovery of bacteria as well as other things, Koch with the notion or the science of proving that some bacteria could actually cause a condition, and Lister, a surgeon in Edinburgh, who again promoted carbolic acid. In addition to washing hands, he would wash the patient's abdomen. He had a mister. This is a little woodcut of him doing his work here. And a mister would be in the room to just spray the air with this carbolic acid while he did his surgery. And he lowered the infection rate. Note also that nobody's wearing a mask, nobody's wearing gloves, no IVs in those days. So those things were advances yet to come, but still an interesting picture as to how all these things came together. And the illnesses at that time, again, infection, a little more trauma. Because people were living longer and the average age was into the 50s, we were seeing people who would get cardiovascular disease, have a stroke, or have a heart attack. And that was about it. And I have a few other statistics here. I think despite the fact that people were living longer, roughly 1/3 of the deaths were to people who were under the age of 20. So again, death at an early age was quite common. And we brought up the idea of alternative medicine, and that wasn't going to go away just because some advances were being made in regular medicine. It hasn't gone away today. But if we look here at what was available in Worcester, we've got vapor baths, we've got electric treatments, we've got sulfur baths, we've got a medical electrician, a clairvoyant. So all these things were even into the 1880s advertised in the Worcester Directory at that time. And I draw your attention to Mrs. Gerald's here, who advertises herself as a midwife and physician. And the reason I draw your attention to this is because anybody could call themselves a physician. You did not need a degree. You did not need to go to medical school, and none of that stuff. So that also just draws attention to some of the challenges that were there as medicine advanced during those years. Now, the patent medicines that Dr. Ball anticipated persisted, and sometimes they would let you know what was in it, like cocaine tooth drops to treat babies' teething pains. Generally, the ingredients were secret. And generally, if it was a liquid, one of the secret ingredients was alcohol. And so these are the kinds of things that we would see out there. In addition to Ball's bitters, there was a Dr. Phelps in Shrewsbury who had these posters that advertised Worcester as his home base, but he was in Shrewsbury. So these were the kinds of things that were out there, promising anything, no regulation, and just to give you a sense as to how that was. Now, with these advances, I think we started to see hospitals as well, not here in Northborough, but in Worcester. And the Worcester State, which was then called the Worcester Insane Asylum, it was the first state-sponsored hospital for the mentally ill, for the humane treatment of the mentally ill. And it was open to anyone if the members of a community felt that one of their residents needed to go there. They would send them, and the town would pay a fee to the Worcester State to take care of them. And so in your annual reports, if you were to look at the annual reports from the 19th century here, they would have a little line in there as to how much they were paying to Worcester State. This was the hospital for the state. And as you can imagine, it filled up pretty quickly. It started off on Summer Street, across where the current St. Vincent's is, and would only hold about 100 patients. But because it filled up, later on, 1876, across from where UMass Medical School is today, went an enormous campus, which at its highest occupancy had a couple thousand patients in it. And was an institution in which there was a lot of care given, there was a lot of research being done, and it delivered a service that wasn't available elsewhere. Now, in 1871, the residents or the government of the city of Worcester decided that having a charitable hospital for those who were ill would be a good idea. They opened up initially in a house on Front Street. Front Street is right across from the Worcester Common in Worcester. They outgrew that probably in a year and moved to Queen Street. And what you see here is really a remarkable organization with nurses' quarters and surgery buildings and the like. Just really remarkable. And City Hospital functioned into the well into the 20th century. Delivering care that was excellent and training doctors and was a center of good health care. Now, after City Hospital moved out of that house, Ichabod Washburn, in his will, left money to memorialize his two daughters who had passed away. And they opened up initially the Washburn Dispensary in the same little house that was the house for City Hospital, and then moved over to Belmont Street and started with this house and expanded around it. And basically over I came here in 1979, and you could still see some of the skeletons of those old buildings there that you'd walk through and see some of the old hallways and everything. But that's where it started. That's how it looked. And then in 1893, the Sisters of Providence felt that there was a need to deliver health care, particularly for doctors who were Catholics and patients who were Catholics. What was going on here is while Northborough expanded from 700 to 2,200 during the 1800s, Worcester went from 2,500 to 19,000 in 1850 to 115,000 in 1900. And so they had a massive influx of immigrants, a lot of them from Ireland, a lot of them Irish Catholics and the like. So you can imagine that the Sisters of Providence felt that there was a need under those circumstances. And then lastly, there were some homeopaths practicing in Worcester, and they started Hahnemann Hospital, named after Dr. Hahnemann, who had started homeopathy. That expanded to basically traditional medicine around 1910 and survived as a hospital delivering care into the 1990s or so. So that's the situation with hospitals. When we look at education, because now we're getting to the point where if you don't know everything you need to know, you can really do a lot of harm. Prior to 1840, it was kind of a toss-up as to whether having an education was a benefit or not. Now, not so much. So up until the 1860s, there were few or no prerequisites to getting into medical school. And there was a 2-year curriculum. You'd go for 3 months, twice a year, and the second year was a repeat of the first. You often would just buy tickets to one class. You'd get an oral exam. You'd move along. You didn't see patients. You just listen to the theory, you listen to the professor talk to you. That was it. And to dramatize this, even Harvard, in 1869, the dean of the university approached the dean of the medical school and said that he really would like to see them up their standards a little bit, give written exams instead of oral exams. And the response of the dean was, and the faculty was, they did not want to do that because they would lose half of their students. And the university dean insisted. He got his way. They had, a significant, about 40 or 50% drop in their population of students as a result of that. Obviously, they've recovered very nicely. But in 1892, Johns Hopkins, in his will, had a vision for what medical education should be, and that was transformative. The Johns Hopkins model basically was that they would require that people going to medical school have an undergraduate degree. They would require 2 years of basic science training. They then would have 2 years of clinical exposure in a hospital that was related to the medical school. So that was the innovation there. It was a massive increase in the quality of education that occurred, and also that they would admit women as on an equal basis with men. That was an interesting little twist that came in at the last minute because they were running out of money, and there was a rich widow. And she and her colleagues basically said, if you want the money, this is what you're going to do. And they did. So those were the standards really went up as a result of that, and we had a transformation in medical education. So let's look at a couple of physicians. I'm just going to skim over a couple of doctors, give you a little bit of a street view of their houses, and give you a sense as to what was happening in the second half of the century. So Stephen Ball III, I don't have a picture of him. He was educated by his father. He practiced here in Boston. He built a house in the 1860s right next to the library, a house that you're all familiar with. Right there. And so that persists and survives to this day as a beautiful building. But that was started by Stephen Ball III, late 1860s. And as I say, he was a practitioner who came down from several generations of physicians in Northborough. Henry Jewett, 60 Main Street, a member of the Worcester District Medical Society starting in 1849. Not a clear record as to where he went to medical school. Yeah, he may have gone to medical school in Philadelphia, but that was unclear. They really didn't have great documentation of that. But his house, to this day, survives as Gray's Carpet. And so that is another place which, when you're driving by, you can say there's a connection with the history of medicine in this community, with that home right there. And if we look at his day book, which Ellen mentioned to you, and she found that really interesting piece in there about pulling the bean out of a boy's nose in Shrewsbury. Basically, he was seeing 5 to 7 visits a day. He would charge about that much. He would accept barter. The majority of his notes were basically a date, a person, a charge, and that sort of thing. Sometimes they would put in, if it was something interesting like a bean in the nose, he might want to put that in there for posterity. But that was how the book was. And as I say, we have that book here. We also have one of his recipe books for the various potions that he was putting together at the time. So those are nice pieces of the collection that you have right here. And then we have Henry Jabez Barnes. We've got his better photograph of him over here as well. But look here, he was at 30 Main Street as well. So when Ball III moved out, Henry Jabez Barnes moved in. And so that is yet another connection to medical history with that. He was a graduate in 1872 of Harvard Medical School. And other interesting pieces about that is that his father was Henry Barnes as well. His father was a doctor in Northborough as well, and his father was trained by Ball II, Stephen Ball II. And his mother was Stephen Ball II's daughter. So the genealogy runs pretty close here in Northborough for medicine. So those are some tidbits there. Finally, another connection, nothing to do with the 19th century, but Gregory Pincus, who with Rock and with Chang worked with the Worcester Foundation in the 1950s and developed the birth control pill. Pincus lived there. So he died in 1967, but nonetheless that is one more connection of that house to medicine in Northborough. And then we have Josiah Stanley, also a Worcester District Medical Society member, so he went through the examination process and everything. And he was at 25 Main Street, across the street from 30. And we don't have a picture today of that, so I can't give you a street view of that because that's a parking lot of the church right now. But this is what his house looked like in those days up until the 20th century. And so then let's take a look at pharmacy. And there have been a couple of pharmacies, basically with the exception of Dr. Ball in his little store next to his house. There wasn't a lot going on until about 1868 or so. But an awful lot was going on, in that corner of the town hall. And so what we have here initially is what is noted as Northborough Drug Store. And you can see something just arrived that people are interested in. I don't know. Who knows? But this was run by A.S. Waite, who was the city clerk at the time. And he ran it until 1871 and then sold it to C.W. Hamilton, who then, after that, sold it to Wood. And you see the sign changes here in the same spot, Wood's Pharmacy. And then Wood sold it to Shattuck in 1899 after a couple of transitions. So the Shattuck Drug Store dates right back to 1899 and Claude Shattuck, and was at that location until they, as most of you know, moved across the street and then more recently closed. But this, basically, this Shattuck Pharmacy was serving Northborough for over 120 years, I'd say, or 120 years. Really good. And here's a view that you have here. These are pictures from the Northborough Medical Society, or Northborough Historical Society, of the inside of Shattuck's pharmacy, as well as their collection of medications that they've had. So there we are. We've taken a look at medicine, how it transitioned from something that was very primitive to something that was getting to be more sophisticated. And bacteria was discovered during that time, the value of hygiene and antisepsis, anesthesia and the surgical advances. And I mentioned anybody could call themselves a doctor, but in 1894, the Massachusetts Board of Registration in Medicine began to require doctors to register to get a license. It began to impose some standards. And so there was an improvement that started then and continues to this day. Hospitals evolved from almshouses to something where the most modern medicine was being given to everyone. And medicine, education, as I mentioned to you, changed quite a bit. Pharmacy was professionalized, and Shattuck Pharmacy was started. And a couple of things on the horizon to mention that occurred in the early 20th century. One is the Pure Food and Drug Act. I mentioned to you that anybody could sell anything and promise anything and not tell you what was in it. And enough harm was reported as a result of that there was legislation starting with the Pure Food and Drug Act in 1906, which started what we have today as the Food and Drug Administration. And initially, they weren't even requiring that drugs be effective. They simply didn't want them to kill the patients. And so they said the standards were it needs to be pure, it needs to be consistent, and it needs to not do harm. They have to test it for those things, as well as to disclose their contents. So those are the kinds of things there. The Flexner report was a result of the fact that anybody could go to medical school, anybody could get a degree. There were a lot of degree mills, and yet you had this school such as Johns Hopkins out there that was really playing a different game. And so the American Medical Association and the Carnegie Foundation commissioned what was called the Flexner Report in 1910. And that was an instance in which Dr. Flexner visited every medical school in the United States and Canada and wrote a very terse, no-holds-barred report on every medical school, essentially holding them to the Johns Hopkins standard and saying, are they good enough or not? And as a result of that report and the publicity it received, within a decade or so of the report being released, about half of the medical schools in the United States closed or merged with another institution or changed the quality of education they were giving. So it had a profound effect on the standard of medical education. And then as medicine advanced, we get specialties, the first of which was ophthalmology in 1916. So that's a big sketch of what medicine looked like, 19th century oozing into the 20th century here, and at least some street views of what it looked like here in Northborough. So thank you very much, and I really want to thank Ellen. Everybody knows that she's an incredibly helpful person, and she's made my research for this project just really enjoyable and easy, and I really appreciate it. Bob Ellis wrote an hourglass profile of Henry Jewett in 2013, which just gave a very nice picture of one doctor's practice. And then back in the 80s, there was a very nice profile, a presentation on the Stephen Ball family. And in the 40s and 50s, there were two presentations by Alice Kimball on Northborough pharmacies and the evolution of that. So there we are. Thank you very much. I have some instruments up here if anybody is interested, or if someone wanted to try their hand at medicine. And if anybody has any questions, I'd be happy.
I've always wondered, this bloodletting.
Yes.
Why did it continue so long? I mean, what positive things resulted after they took blood from a person that the doctors were so long and people think that it was a good thing to do? We are accustomed to people running tests, to people doing studies where they compare one group to another. And really, up until the 1840s, we were dealing with just an authority-based, you do what your master tells you to do. Here's a theory that goes back to Galen,
okay? And their logic prevailed over the outcomes of patients, and nobody was counting. There was, you know, people were accumulating their own experience with fairly low volume practices over decades, and with patients who, in many cases, were either going to get better on their own or die. And so once you had better evidence, and around 1830 or so, you started getting a little bit more definitive things, and people started to move away. The other piece is to have something to do. If you have nothing to offer, it doesn't work out.
Could it be the bias that you only consider the people that got improved by the
Yeah, sure.
It worked for them.
Yeah, yeah. But I mean, and we're talking about, you know, not just a few drops in you know, that sort of thing. George Washington ordered his first bleeding. How's that? Called the doctors, I need to be bled. And by the time they were through with him, they had bled out 80 ounces. Yeah. So we're talking about substantial volumes. Of course.
Yeah, I was wondering, do you have any thoughts about how many deaths, early deaths, could be attributed to the medical treatment they received?
Yeah, you know, the trouble is you don't really have the kind of record keeping that we need, but it's not hard to imagine that there were a lot of deaths when people are being, especially if they're repeatedly taking drugs that are toxic but don't kill them instantly. And so if you have people who are taking mercury, or if you have things like that chronically, you can see where that would really do harm. Yes.
I wonder what your standpoint is with the 21st or 22nd century medicine, where you have a group of people suddenly who are anti-vaccination.
Yeah.
What is your stand on this? How did it occur in the society suddenly with, let's say, COVID? And immunization is always applied, but suddenly.
Yeah, you know, I don't have an answer for that. And if I did, then boy, you know, I could do some good. But there are a couple of thoughts that I have. One is it's nothing new, okay? And so if we look back at when they were doing, instead of vaccination using a modified virus, they were basically inoculating people with a little bit of smallpox virus. That was controversial. There were drawings from the 18th century of people with, you know, all kinds of things going on with them. And even in his early life, when Ben Franklin was in publishing and trying to sell newspapers, he was getting people revved up against inoculation in the 1720 epidemic that occurred. Later on, you had people, when they introduced the cowpox vaccination in the 1800s, you saw cartoons of people with cows jumping out of them. You know, and during the flu pandemic of 1918, I have a newspaper report where they were mandating masks in 1918. And the Department of Health and the sheriff went out to I'm blocking his name, but he was basically a person who was running an office for a blacksmith's house. He shot him. You know, they were going to insist that he wear a mask. So I think that there's a don't tell me what to do is a big part of it. And I think that the don't tell me what to do part maybe plays a little bolder here in the United States than it may elsewhere. But I think that's a huge part of it. Yes?
If any, were the protocols for the treatment of consumption in New England? What did they do? Did they just pat patients and go away? Or?
You know, later on it was fresh air, and I think that persisted into the 20th century. They really didn't have effective drugs for that until the 1940s or so. And so you would look at rest and you would look at fresh air, that sort of thing. Early on in the 20th century, and I don't know if they started it, I doubt they started in the 18th, they would cut a nerve to the diaphragm and rest the lung was the idea, so that that lung wouldn't breathe with the other one. So there were very, crude attempts at trying to help it, but it was still the dominant killer and it was huge in that. Yes.
You showed the different diseases people died by pneumonia.
I'm
You showed a list of some of the
Yes, yes.
common pneumonia, scald fever,
Yes.
and a few others. That we
Yes.
can't so much. Well, but I didn't see cancer.
Right.
I did not see heart disease.
Right.
I didn't see Alzheimer's.
Right.
People that
So they were. I put the top ones there because they dominated. As the average age increased, as you started to see people in their 70s and 80s, then the incidence of cancer is going to go up because that tends to be a disease that is more common in those who are older. And cardiovascular disease ditto. So there was that. I would say the issues regarding other risk factors for cardiovascular disease, people were a lot more active in those days. There was, people who tended to weigh a little bit less, be physically more vigorous. So, there's that part as well. They were occurring. You would still see people dying of a stroke or dying of a heart attack, but the dominant things there overwhelmingly were infection, and tuberculosis was like way out front.
I noticed there was a medicine for asthma cigarettes.
Yeah.
Did they really think that these cigarettes could help the asthma?
The people who came out with these things, if you look at the number of things that these things were supposed to cure, they weren't even testing them to see if they worked on anybody. I can tell you that. And there's a fairly interesting book about Lydia Pinkham's remedy. Lydia Pinkham's remedy was made in Lynn, Massachusetts, and achieved extreme popularity in this country, but it was promoted by her sons who basically figured out how to promote this and make promises, and it's fairly well documented in their approach to things that they would just see what's sold. It really wasn't, nothing was tested. Okay, well, sorry.
Last point, I'm showing my ignorance. One of our presidents became president because of bloodletting. And I don't know if it was Garfield that was assassinated.
Yeah.
And he was on his recovering his bed. They did bloodletting on him.
Yeah.
And he died because of the bloodletting.
Yeah.
And so, I don't know, Arthur, his vice president became president. President Arthur became president because they did bloodletting on him.
Yeah, Garfield's story is kind of complicated. I'm pretty sure he's the one who took a bullet, and the doctors were using their fingers to try to dig it out. And he died sometime after the bullet hit him. It is very likely that the fingers did it, yes. Well, again, thank you very much for inviting me to talk.